Ways and Means informational briefing on the Governor's Office budget and the Office of Lieutenant Governor's budget. So I think we have someone from the Governor's Office. Okay, yeah, you can go unmute. Good afternoon.
Thank you. Would you like me to get started?
Yes, please. Good afternoon.
Thanks. You want to turn off the music?
Yeah.
I could sing it, I guess.
I'm not sure whose that is. There. Oh.
You're gonna mute everybody.
Okay, can everybody mute? Except for Chief of Staff?
Yes, music.
So I think we have someone from the governor's
We have a
office.
radio on. You can't mute everybody?
Oh, I think there's a TV echoing, Linda. Is there a TV near you guys?
Do you have a TV on, Linda? Do you have a TV on?
Oh, you know what? That might be me. Okay, there we go.
Okay.
Sorry.
Thank you for joining us.
I'll get started.
Okay.
Chair Dela Cruz, Vice Chair Kitagaran, and members of the committee. My name is Linda Chu Takayama, and I am here on behalf of Governor David Ige. The Office of the Governor seeks to enhance the effectiveness and efficiency of state programs by providing executive direction, policy development, program coordination, and planning and budgeting. The Governor is the Chief Executive Officer of the State of Hawaii's executive branch and is the head of state representing Hawaii in national and international affairs. In addition to the Oahu office, there are 4 neighborhood island offices to serve constituents across the state. The Governor's senior staff includes myself as Chief of Staff, a Chief of Operations, and Directors of Communication, Executive Administrative Services, Intergovernmental Relations and Policy, and a Protocol Officer. One of the functions of the Governor's Office includes developing and maintaining intergovernmental relationships. As such, the office includes developing and maintaining those relationships. We're requesting $13,000 in each of the next 2 fiscal years to support efforts to develop and maintain intergovernmental programs and relationships that advance the various interests of the state. In addition, the 175th anniversary of Washington Place will be occurring in 2021. Funding to support this event has been requested for fiscal year 2022. We appreciate the consideration you have and will be available to answer your questions. Thank you for your continued support of the Governor's Office budget. In addition to our testimony, there were some questions that were submitted by the committee. Would you know, we're prepared to answer those questions if you would like me to do that now.
Yeah, please, go ahead.
Okay. It was noted that the Governor's Office identified 7 vacancies, 2 of which were expected to be filled by the end of the year. And the question A was, have those 2 positions been filled? Answer is yes, they have. And for the 5 positions that remain vacant, are they included in the 550 defunded positions that the Governor is proposing to eliminate? And the answer is no, they're not included in the 550 because the positions are funded and we are intending to fill them. Second question, in addition to cabinet, will senior staff in the Governor's office be subject to proposed salary cuts? And the answer is that the Governor's office, including the Governor himself and all of the cabinet members, will follow the same cuts and furloughs that are imposed on any of the executive branch employees. So we'll all be in the same boat together. Third question, somewhat related, will the governor's proposed furloughs also affect staff and functions within the governor's office? And the answer to that is yes, of course we will. 4, please provide details on the functions and roles of the Constituent Services Office and the Protocol and Community Affairs Office under the Chief Operating Officer. The Constituent Services Office is meant to respond to constituent concerns in a timely and accurate manner to ensure that the governor, the office, and the various state departments are responsive to the needs and concerns of the general public, as well as a broad range of private and public sector organizations. It interacts and develops relationships with constituents and community leaders and represents and or staffs the governor at meetings or events in the community. Primarily, this is the role of the Neighbor Island offices, and maintains and manages the governor's Neighbor Island offices statewide and facilitates responses from state departments to constituent concerns. This office receives about 600 to 1,000 email messages and phone calls through the governor's website each week. We do keep track, and the number hasn't really gone down very much in all the time that I've been here. The other is the Protocol and Community Affairs Office. And the overall objective of this office is to manage and coordinate the preparation, execution, and staffing activities to ensure events involving the governor and or the First Lady are supported and executed. It directs and coordinates scheduling, staffing, coordinating meetings and public appearances, researches and develops advanced information, including talking points for all events, provides on-site support at the events, understands and provides guidance regarding diplomatic etiquette, customs, and background for VIPs at meetings and events, and maintains current knowledge regarding the Code of Conduct protocols related to exchanging of gifts and other logistic items for dignitaries during their visits and meetings. The unit is also responsible for overseeing and managing the commemorative messages issued by the governor's office. And I think that was the extent of the questions that were directed to us, and I'm happy to answer any other questions you may have.
Members, any questions? I can't see. You see anybody? No. You have a question? Senator Moriwaki?
Hi, Linda. Happy New Year. You know, when we met with the Senate met with the governor, he mentioned the strike force of looking at government efficiency, and I see that that's one of the effectiveness, efficiency of state programs, one of the things that the governor should be overseeing. And I'm just wondering, whatever, or have you followed up with that? Is there a strike force that is overseeing, working with DNF, with DAGs, other agencies?
It ended up not being a formally organized group. We did it kind of informally, given all of the things that had been occurring and coming at us at pretty rapid pace with regard particularly to the pandemic and the issues related to safe travels. So we did it kind of more of on an informal basis. The core group being basically the budget folks, which included myself, the governor, budget and finance folks, DHERD, and others, as we went through the review process with each of the departments separately. So we ended up, in the interests of time, not being able to do a formal kind of a review. But you will see evidence of that, I think, in the budget that's been prepared for this session.
So has there been any follow-up in terms of looking at government efficiency and effectiveness in terms of at least the control agencies, supposedly the support agencies like HRD, BNF, and DAGs, as they support all the line departments so they can serve the public faster and better?
We only, as I mentioned before, we only did it in the course of the programmatic reviews. I think when things settle down a little bit more, it might be possible for us to get enough breathing room to actually do a good job of ferreting through all of those things. But in the course of the last, I guess, 6 months or so, we just, we barely had enough time to address the issues that were flying at us from the pandemic side. And we really did not have an opportunity to do it as well as we could have.
But during the pandemic, it sort of was an opportunity to also pause and see what we're not doing so well, which we heard a lot from the COVID committee, from the public, that hopefully your departments had heard a lot, and maybe they're coming up with procedures, processes where it can be fast-tracking federal funding, ways in which they serve the public better, how they make decisions. Has any of that come up to you folks to look at how you can be more efficient in the way the agencies support the people who are really on the line?
Yeah, I suppose hindsight is a lot easier to deal with as opposed to when we are dealing with an issue that is unprecedented in the whole world, essentially. And so we were making decisions on the fly as best we could. It was very challenging at times because, as I said, decisions were being made on the fly. And unfortunately, there were a lot of folks out there in the community, and deservedly so. Everybody wanted to be at the table. Everybody wanted to know first, and it wasn't always possible to give them that opportunity. So we learned a lot of lessons as a result of that, and there were things maybe in retrospect we could have done better, particularly on the communication side. But ultimately, I think you have to look at the results. It wasn't always pretty, but if you look at where we were in the last week, Hawaii had the lowest infection rate in the country. And if you look at the period of the pandemic, which is from March to current, Hawaii has the second lowest infection rate in the country. Only Vermont has a lower infection rate. And for the last week, Hawaii had the lowest death rate in the country. And for the entire pandemic period, we had the lowest death rate in the country as a whole. So yeah, it wasn't always pretty, and we regret that. We're trying to our best to try to fix some of those things now that things have settled down a little bit. But I think the end result was that what decisions were made kept us safe. And that's, still lots of things people can grumble about. There are folks out there that would like to open the doors and let, all the travelers come in. But, there's a price to be paid for that. And for, very good reasons, our state and the public health officials made decisions that kept us from going that route. And I think the end result was that, we're safe.
I think in terms of the COVID and attacking the COVID is one thing, but I think what my question was in terms of your processes, your procedures, how you operate so that government can be more nimble, can be more responsive, more quickly respond to the needs of the public, whether it was unemployment or housing relief, or as well as health and health information. What have you learned so that we can take that forward into a new way of operating for government so that we can be a better government for the people that expect that of us. So if you know, you have some of that, I think that's the kind of stuff we should be building on. And yes, we were one of the lowest in terms of COVID and COVID positivity and death, and that's a good thing. But we really need to learn how we provide those services that people really are crying for in a better way, a faster way. Whether it's affordable housing, homeless, housing relief, all of that should be really looked at. And I hope the governor's office is really pushing the departments, encouraging the departments to think a little bit more outside their restricted silos to see how we can better serve the public.
Absolutely, and I think to a large extent, we will, we hope that we'll be able to work with the legislature on making some of those changes. You'll see that in some of the legislation we'll be sending to you this year. You know, we can't change the world overnight, but we have identified some things that could work a little bit better. We've chosen some areas that don't cost a whole lot of money to do it. And like I said, you'll see some of that in the legislation we'll be sending to you. There are other things that are urgently needed. So for instance, and we learn this as we go along, just because we've never had to fix this before. But one of the things that we hope you will consider early and quickly is a change in the way the rates are formulated for unemployment insurance. That's one of my biggest concerns right now, because we had to take out a loan of more than $1 billion, and probably more to come to pay the unemployment benefits. That loan gets paid back by a tax on business, and at the rate we'll have to reimburse it, and this is by state and federal law. The reimbursement comes from a tax on business. At $1 billion, we will go from rate level C to the highest level, which is rate level H. That essentially is going to be a tripling of the taxes on business, at a time when business has been taking some really big hits all along. Some of them are just on the edge, barely able to survive. We don't want to have to hit them with yet another gigantic tax burden. So one of the most important pieces of legislation that will come before you this year is a request to change the rate of taxation, the way the formula is produced, and asking for a staggering of how that formula, that rate is applied, so that it is less of a burden. It still will be a burden, any tax is, but it won't come all at once. So there are tweaks like that that need to be made, and as I said, there's a bunch of others that we've identified, and we'll be sending them down to you probably in the course of the next 2 years, because you know we're not going to send it all down at once. Some of it we're still trying to figure out what the best way is to handle it, but there are a number of things. But we look forward to working with you on how to do some of that stuff.
I look forward to seeing that, as well as some procedural changes that you can do administratively as well. Not everything is legislative, but we would like to get reports on what you're doing administratively as well.
Sure.
Thank you. Thank you, Chair.
Members, any questions for the governor's office? Okay, thank you. Thank you, Linda.
Thank you.
You need a minute or two, or you just want to? Okay, so next on the agenda, we have the Office of the Lieutenant Governor. Good afternoon.
Hey, good afternoon. Good to see you guys. Chair, good to see you.
Good to see you.
So I'll just make a couple general comments. Is that
Yeah.
what you prefer? Okay, good to see everybody. So I think everyone's pretty aware that obviously the year's been very tough. We have been living in our means, obviously. We did not fill some positions that we have. And over the last 2, 3, 4 years, there's been a pretty steep reduction in the resources for the Lieutenant Governor's office, but we make do. We've seen about a 36% decrease over time. So just I'll race through these questions because I know you've got a long day that we received. Happy to help in any way. There was a question about the proposed 10, 15, and 20% reduction scenarios in the budget where we requested to do those. We gave those scenarios, yes, over to the team. It would be very difficult because we're so small, and we are exempted per his EM 20-07 for it being a tiny department, under $4 million. He didn't want those applied. But we'd already kind of faced those cuts down and didn't fill a couple positions that we would have liked to have in capacity for us. The next question was, given the fact that our staff has not been fully staffed, our department, how have we been able to meet our demands? Well, basically, we've just been working harder and spreading out the work. But the decrease in staff with the loss of funding for the senior advisor position has been a challenge. Basically, we just do more with less, do our best. Obviously, we've taken on a lot of pretty large roles during COVID just by circumstance for me being a physician. The third question is, does our office receive any funding for any of our auxiliary roles? If so, from where and how much? We don't have any extra resources whatsoever. Again, make do. Are there any status or measures of effectiveness reports in these auxiliary roles? Well, there's been extensive talk about the Safe Travels program for sure, lots of reports and so on, and which I think has been pretty well documented to be succeeding for what it's meant to do, which was to get our state open and restore some of our economic activity while we're continuing to wrestle with COVID. We also have had some successes with the smaller programs that we've done, like Cal Hawai'i. We've been very honored to work with, current company included on these. We haven't asked for any resources, or I should say we haven't received any resources. We asked, but at times were tough, of course, last session for Cal Hawai'i appropriations. And the last question was, how much strain do these additional roles assigned above and beyond the normal Secretary of State position, function of the LG and stuff have? Well, everyone's just doing their best. But do we feel strained? We kind of enjoy the work, honestly. And so it's no strain at all. Would we like to have more resources? Of course, but we're in the throes of a deep, deep, deep recession. So we're mindful of that. And we get the job done. If we had our way, of course, we'd ask for additional positions or the restoration of some of those resources. We know that that's not really feasible. We would like to have resources for special projects, but we're in support of the Gov whenever necessary. There are some minor things that we have not had resources for, computer systems and carpeting and things like that to make the office appear, quintessentially professional. But again, we're a working office and it's been a pleasure to do it. So all of those things being equal, we accept our, what we got. The last thing I would say is we are providing a ton of support for COVID, the response, and so on. I mean, if CARES resources do become available and you guys need to place them somewhere, we can augment our staff and continue. We kick butt pretty well in our office, and we can magnify the effects of what we do amazingly, pretty much going from 4 a.m. till late, like everybody, But we do magnify a lot of that because the influence that the Lieutenant Governor position can have on emergency response and other pieces of this with the healthcare system is good. It's very effective. But we end up doing it just with me and my chief of staff and our small team. We just make it happen. So I thought I'd just stop there and answer any questions.
So you can't get CARES Act monies to supplement your staffing, at least to get through the pandemic and what you're doing with the network?
We could. The very nature of being LG is to not ask outside of whatever is the pleasure of the governor and the Senate, honestly, and the House. If you decided, though, we do have some space, right? And we can do a lot more. Of course, the pandemic created this new role. It didn't exist beforehand, so it's kind of a one-off. But if anybody did need to place meaningful work by our side, we'll use it.
Members, any questions on Zoom? None? You have a question? Go ahead.
For the vaccine, a lot of people are asking how much more we're going to be needing. A lot of our seniors are getting sick and passing away, I'm hearing, and what more can we do
Yes.
as a state?
Brilliant question. For the vaccine, we'll be having a press conference tomorrow, actually outlining a ton of this, but I can tell you, the more resources that we have to implement the vaccination program, the faster we'll get those vaccines out the door. We now have 91,000 vaccines, I should say as of tomorrow early morning when the rest of this current batch lands. We're going to be in partnership with the Healthcare Association and the hospitals to push out a lot of this vaccine. And some of the legislative leadership is helping us to use some big facilities here. So we're already in 1A deeply, which is healthcare community and kupuna at nursing homes. They're getting vaccinated right now. And then the next groups of people are critical infrastructure and 75 plus kupuna. So that's also happening now, but it's going to be very, very vibrant as we can open up these additional pods. So the more spaces that we offer, the more quickly we'll get everyone vaccinated. And if we have as many places as we can fund, then instead of ever having a 2 or 3 week delay, we can probably put the vaccines into people's arms this very same week that they arrive. We are going to get it paid for pretty much by the partners we have at HMSA and Queens, because they will just bill for through insurance, which covers the administration of the vaccine cost. The vaccine is free otherwise. So they're not even asking us for money per se, although you can imagine. I mean, if we were able to use the convention center, I'm hearing that may not be something that they're willing to waive the cost on, even though we own it. There may be some benefits. And the federal dollars that are coming in from the most recent CARES Act monies will be really helpful to administer all the vaccines. We should be able to do it all of the high-risk individuals in the next 3 to 4 months, and then it'll, for communities that are less seriously impacted, just healthy young people, it'll drift into the summer. But all of that's good for us.
What is the projection? What is your projection for, the vaccine getting out to all of these communities, like you said? 3 or 4 months?
I think, so I would say by the end of February, we should get through all the highest risk individuals, particularly the 1A category. The 1B category, which is critical infrastructure, honestly, keeping ports open, keeping government going, keeping food supply going, keeping energy together, and 75 plus. It's about 50,000 critical infrastructure workers and 109,000 kupuna who are 75 and older. That's so 150,000 or so, 159,000. Then 1C, so we're going to get 75,000 people per month at our best clip. 150,000 doses, 75,000 people. So it's about 2 months. And then the next or last leg of people who are very vulnerable are 65 plus, people with chronic diseases, and the rest of the infrastructure individuals that are not as high risk. I should mention teachers are in 1B also with critical infrastructure. That will take another couple months, and then we'll be in the clear as far as risk goes. But in the summertime, people like 42-year-old healthy person that's not in an infrastructure role, that's when they'll be offered the vaccine.
So are there different places, like points of distribution, or is that going to be any you go to your doctor and you get it, or how is that progression work?
Great question. Mostly for these first categories, 1A, 1B, 1C, it'll be hospitals and their centers, and then big vaccination centers.
Like Leeward.
Yes, exactly. That's exactly right. Like Leeward. Then it will be eventually, when it gets kind of smooth sailing and it's lower risk, then pharmacies will most likely do it, and maybe some physician offices or nurse practitioner offices. It'll be so easy by then. Plus, this first set of vaccines, I don't want to take too much of your time, but are hard because they're super low temperature. So you kind of have to do them at institutions and stuff. But when we get the Johnson & Johnson and the AstraZeneca ones in, they're not as low. The regular refrigerators, have at it. Yeah.
Any other questions? If not, thank you.
Thank you.
Thank you, guys.
Thank you. Happy
Appreciate
New
it.
Year.
Happy New Year.
Thank you.